Hi everyone, welcome to another webisode of The Good Doctor on eZeLiving.com. I have the pleasure of being in the company of Dr. Alexander Krakovsky, who's a plastic surgeon from the United States, now visiting the United Arab Emirates and working at the Sharjah Corniche Hospital. Today's topic of conversation, doctor, is liposuction. Who needs it and what is the procedure that's involved? And the third question I'm going to ask you is, do we have the expertise in this region to actually fulfill this procedure risk-free?
Thank you for your questions. I'll be happy to answer them all, but before I will answer your question, I would like to express my personal appreciation to Dr. Mahesh Vidani, who is a CEO of Sharjah Corniche Hospital, who opened his door for me to do a plastic surgery operation in his clinic and the hospital. He's a great doctor, he's a great CEO, and he's a friend of mine as well. Also, my appreciation to the Ministry of Health for the official plastic surgery license in United Arab Emirates as an American doctor who does not live here, just a visiting. Sure. It is a great pleasure to be here and work here. With regards to your questions, number one, I would like to say that a liposuction surgery that already has over 30 years of history around the world, very well developed and safe. In the United States, we have millions of liposuctions performed a year. So you can imagine that if there is a risk or dissatisfaction or not very good result, it would not be that amount of surgery performed on a yearly basis.
The demand is growing.
Demand is growing, so the procedure is safe. I want everybody to understand that there is no risk involved today in liposuction surgery. Even if it's called surgery, it's a super minimum invasive surgery. And it's available around the world and here in UAE. Not many doctors here have an expertise to perform liposuction surgery locally, but there is an education facility in Sharjah Corniche Hospital where they can go and get training on the World Academy of Aesthetic Medicine and Plastic Surgery with a week of training started from A to Z. They will be able to learn everything about liposuction surgery and, what is the most important, practically under my supervision, perform plastic surgery in a real patient, liposuction surgery, and after that they will be able to do it on their own.
What are some of the complications? Obviously you're trying to minimize the risk factor or train these doctors to be more careful. So what are the risk factors?
I wouldn't say a risk factor. I would say the most common is a dissatisfaction. Patient's dissatisfaction with the result. But you have to understand that the dissatisfaction came from not complete understanding of what liposuction surgery can do and cannot do. First of all, it is not a treatment for obesity or overweight. People have an idea that there is a quick fix to get liposuction performed and get rid of all fat in multiple places in the body. No, it is not. The ideal candidate is not a very big person, man or woman, who has localized fat deposits. And that's what liposuction actually is all about. It also stimulates in everybody ability to look better, to have a body in shape, improve self-confidence, self-esteem, self-appreciation, presenting himself or herself in the world in the best positive way.
And we're talking about body contouring.
We are talking about body contouring.
Right. So liposuction is more ideal or focused towards people who want better contouring of their body, What parts are we talking about here?
Multiple parts. It is abdomen, it is flanks, we call it love handles. It is outer thigh, it's an inner thigh, it's all, actually arms, it could be neck, like a double chin correction, could be back as well. So there are multiple parts of a human body where the localized fat deposit can be removed.
Is it painful?
It is minimally painful because the solution what we injecting inside the body, they call tumescent solution anesthesia,
right,
has analgesic inside of it. And when it's analgesic injected, it stays in the body. So it's not painful procedure.
Right. So after the recovery process, is it like, what's the feeling? Do people feel like you know, the aches and pains of going to a gym and working out strenuously, or is it a pain where you sort of have to recover from a scar, like a cut? What kind of, what's the sensation?
It is not a cut because we do liposuction, or we call it lipoplasty, using a very small cannula, 3 millimeters or 4 millimeters. That's a very small hole in the body when we put the cannula in and suction fat out.
How long is a procedure?
Well, the longest procedure probably between 2 hours, 2.5 hours.
Right.
But again, the recovery is so easy and the almost pain-free, and the patient can go back to work in 1 day.
If you have any thoughts or questions on liposuction and you want to know what the procedure involves, what parts of the body is ideal, and the good doctor just stated about contouring, you feel like you want to improve your image, that ultimately helps with your self-esteem, please leave your comments down below, and we will definitely be able to talk to Dr. Alex and get his feedback on your questions. Thanks for watching The Good Doctor on eZeLiving.com, where you can find anything and everything lifestyle.